Strategies for resolving ethical conflicts in clinical practice. In clinical practice, especially in sensitive fields like reproductive medicine, ethical conflicts are bound to arise. These conflicts may involve complex issues related to autonomy, beneficence, non-maleficence, justice, and other moral principles. Resolving these ethical conflicts requires healthcare providers to follow structured approaches that ensure ethical decision-making while respecting the rights of patients, ensuring well-being, and promoting fairness. Here are strategies for resolving ethical conflicts in clinical practice. 1. Identifying the ethical issue. A. Clarifying the dilemma. The first step is to identify the ethical issue. This involves distinguishing between what is a clinical decision and what is an ethical dilemma. Ethical dilemmas often arise when there is a conflict between two or more ethical principles, such as respecting patient autonomy versus minimizing harm. Example: in reproductive medicine, a situation might arise where a couple wishes to undergo embryo selection based on genetic screening to avoid hereditary diseases. But the ethical issue involves concerns about the implications of genetic selection on societal values. B. Gathering relevant information. Clinicians should gather all relevant information, including medical facts, patient preferences, and societal implications. This includes understanding the patient's medical condition, the risks and benefits of proposed interventions, and any legal or institutional guidelines. Example: when faced with the decision of whether to transfer multiple embryos during IVF, a clinician should assess the medical risks, e.g., increased chances of multiple pregnancies, the patient's preferences, and the success rates. 2. Engaging in ethical reflection. A. Using ethical frameworks. Various ethical frameworks, such as the 4-box method, principlism, and ethical decision-making models, can guide healthcare providers in making decisions. These models provide a structure to evaluate the competing ethical principles in the case. The 4-box method involves considering medical indications, what is the clinical situation, patient preferences, what does the patient want, quality of life, how will the decision affect the patient's life, contextual features, what are the social, legal, and financial factors at play. B. Reflecting on personal values. Clinicians must engage in self-reflection to recognize any personal biases that may influence their decision-making. It is important to consider whether their own values align with the ethical principles guiding the patient's care. Personal beliefs must not override the patient's autonomy. Example: a clinician who personally believes in the sanctity of life may face ethical conflict when discussing options for embryo disposition, e.g., discarding unused embryos or donating them for research in IVF. 3rd, consultation and collaboration. A. Multidisciplinary team approach. In complex ethical cases, consulting with a multidisciplinary team, e.g., ethics committees, legal advisors, psychologists, social workers, and other healthcare providers, can offer diverse perspectives on the issue. This helps ensure that all aspects of the dilemma are considered. Example: in a case involving surrogacy, the team might include legal experts to assess the contractual obligations, ethicists to address concerns about exploitation, and mental health professionals to support the emotional well-being of the surrogate. B. Discussing with the patient and family. Patient and family involvement is crucial when resolving ethical conflicts. Open, honest communication should take place where the patient's values, wishes, and preferences are carefully considered. Example: if a patient is unsure about whether to pursue genetic screening, a discussion about their concerns, motivations, and potential benefits and risks of the screening can help clarify the path forward. It's also important to ensure that patients have adequate support, including counseling, to understand the ethical implications of their decisions. 4. Applying ethical decision-making models. Several structured decision-making models are helpful when trying to resolve conflicts. These models guide clinicians through a step-by-step process to ensure that ethical principles are properly weighed. A. The 4-box method. As previously discussed, this model focuses on examining the situation through 4 perspectives: medical indications, patient preferences, quality of life, and contextual features. This structured approach helps ensure that all relevant factors are considered and balanced. B. The principlism approach. Principlism focuses on the 4 primary ethical principles: autonomy, beneficence, non-maleficence, and justice. When a conflict arises, this approach requires weighing the competing principles to find a balanced solution. Example: in a case where a patient seeks a high-risk treatment to achieve a pregnancy, beneficence, clinicians may need to evaluate whether the risks of harm to the patient, non-maleficence, outweigh the benefits of pursuing the treatment. Autonomy and justice may also need to be factored in. C. The ethical decision-making process. This process consists of several steps. Identify the ethical issue. Gather relevant information. Evaluate alternatives. Make a decision. Implement the decision. Evaluate the outcome. This approach ensures a thorough and systematic process for resolving ethical dilemmas. 5. Respecting and balancing ethical principles. A. Prioritizing ethical principles. In some cases, ethical principles will conflict with one another. In such situations, it is essential to carefully prioritize the principles according to the context. For instance, when autonomy conflicts with non-maleficence, clinicians must ensure that the patient's right to make informed decisions does not result in harm. Example: in the case of embryo selection, the autonomy of the parents to choose the healthiest embryos may conflict with the potential harm of discarding embryos that are genetically impaired but still viable. B. Balancing long-term and short-term effects. Clinicians must balance the short-term and long-term effects of their decisions. Ethical conflicts often arise because the short-term benefits of a treatment might conflict with long-term consequences. Example: in the case of multiple embryo transfers, the short-term benefit of higher pregnancy rates may be outweighed by the long-term risks of multiple pregnancies, including preterm birth and other health complications. 6. Documentation and legal considerations. A. Thorough documentation. It is essential to document the decision-making process, including the rationale for the decisions made, the alternatives considered, and the patient's preferences and consent. Proper documentation ensures transparency and protects both the patient and the healthcare provider. Example: In the case of IVF treatment, it is crucial to document the patient's informed consent for multiple embryo transfers and the risks involved, as well as any consultations with specialists regarding the risks. B. Legal guidance. In some situations, legal consultation is required, particularly when ethical dilemmas involve questions of patient rights, donor agreements, or surrogacy contracts. Healthcare providers should consult legal experts to navigate these complexities. Example, when dealing with surrogacy agreements, it may be necessary to consult legal professionals to ensure that the surrogate's rights are protected and that the contract complies with local laws. 7. Continuing education and training. A. Ethical training for healthcare providers. Ongoing education and training in medical ethics are essential for healthcare providers to keep up to date with evolving ethical challenges and legal regulations in reproductive medicine. Example, training sessions on ethical issues related to genetic testing, embryo screening, and patient autonomy can help clinicians make informed and ethical decisions. B. Institutional ethics committees. Many healthcare institutions have ethics committees that assist in resolving complex ethical conflicts. These committees provide guidance and ensure that ethical decisions align with institutional policies and standards. Conclusion: resolving ethical conflicts in clinical practice, particularly in reproductive medicine, involves careful reflection, consultation, and a structured approach to decision-making. By identifying the ethical issue, engaging in reflection, applying decision-making frameworks, and consulting with multidisciplinary teams, healthcare providers can navigate these challenges effectively. It is essential to balance ethical principles, respect patient autonomy, and minimize harm, while also considering the legal and societal implications of clinical decisions. Ultimately, the goal is to ensure that ethical decisions are made transparently, fairly, and in the best interest of the patient.